I'm Dr. Sri. I'm a board certified family medicine sports medicine doctor. In this video, we're going to talk about what is knee osteoarthritis and how I treat patients in my practice. If you want to know more about the evidence of these treatments, then don't worry. I've covered all these things in a separate video and I'm going to link all those video links in the description box below. Without further ado, let's get started. So now let us understand what is knee osteoarthritis. So before we talk about knee osteoarthritis, it is important to understand the anatomy of the knee. So I've got a knee model here. So this bone is called as a femur, which is basically the thigh bone. This bone is called as a tibia, which is basically the shin bone. And then you have a small bone called as a fibula. So this is the inside of the knee. So basically the inside of the knee. And then this one is the outside of the knee. So the bone is covered by cartilage, and this cartilage helps to protect the bone further so that the two bones don't come into contact or there's no friction between those two bones. Then you have two structures called as the meniscus. So you have the medial meniscus, which is the inside meniscus, and you have the lateral meniscus, which is the outside meniscus. And these structures also prevent the bone and bone coming into contact. But you have to understand that meniscus plays an important role in dissipating the joint forces. So think about throwing a stone into a pond and you see the ripples it creates. So basically the ripple represents how the meniscus works to absorb and disperse the force, thereby limiting concentrated stress to the joint. So let us say if someone does not have a properly functioning meniscus, then the arthritis can set in quickly. So arthritis is basically caused by the wearing out of joint tissues such as the meniscus and cartilage. So when the bones are allowed to rub against one another without cushioning, inflammation and pain is going to occur. So constant inflammation can lead to further wear of the cartilage and intensification of the pain. Although there are many grades of osteoarthritis based on X-ray, I'm not going to talk about detail in this video because for me, it doesn't change anything. So for me, it's all about patient symptoms. What is the symptoms that patients present with? So most of the time, patient presents with pain. So sometimes the pain can be inside of the knee. Sometimes it can come outside of the knee. Sometimes patient can have pain just in front of the kneecap here when they have arthritis behind the kneecap. So most patients complain of pain when they're trying to climb the stairs or when they're trying to climb down the stairs. Sometimes patients might have pain in the back of the knee, and that is usually because since the arthritis is in the front of the knee or so, the back of those muscles get tight and thereby causing the pain. So sometimes patients can have swelling in the back of the knee, and we call that as a Baker's cyst. Again, this is a symptom or a sign of knee osteoarthritis. Unfortunately, in my practice, I do see patients with arthritis at a very young age, like 20s, 30s, and 40s. And most of these are secondary osteoarthritis, which basically means that they've had some sort of injury to the knee and thereby predisposing to early arthritis. We already talked about how meniscus is really important to make sure that the patients does not get early arthritis. Some patients could have had a meniscal tear and thereby they have early arthritis set in. But once I see the patient, once I do an exam, then I get a weight-bearing X-ray to see what the knee joint looks like. So now let us say we have confirmed the patient has osteoarthritis. The unfortunate thing is that there is no way to reverse osteoarthritis. However, there are ways to prevent arthritis progression. So don't let anyone try to convince you that arthritis is reversible. So now in the rest of the video, I'm going to discuss how I treat my knee osteoarthritis patients. So basically my style of treating these patients. So my patients' goals are threefold. So one, they want to improve their pain, they want to improve their mobility, and they want to improve their strength. And interestingly, all three are interconnected. So there are certain things that you have to understand before we move further. So we know that bone-on-bone friction caused by a degenerative joint leads to acute inflammation. So we know that. However, we also have to know that dietary habits, weight are also known to contribute to inflammation. It is also known that stress can manifest as physical pain due to elevated levels of inflammation in the body. So it is important to be mindful of one's diet, lifestyle choices, and stress levels in order to manage knee pain. So now let us talk about trying to manage the acute inflammation that is causing you knee pain right now. So Tylenol can actually be a good pain reliever. So usually I tell patients to try 1000 milligrams 3 times a day if they do not have any history of liver disease, and they can combine with a topical medication like topical diclofenac or topical capsaicin cream along with that. But let us say the pain is still not better, then they can try a medication that belongs to the NSAID family, such as like ibuprofen or naproxen. There are prescription medications like meloxicam or diclofenac that can also help with the pain. However, the problems with the NSAID is that they can cause major side effects. So for example, people can have kidney injury from these NSAIDs. They can have increased risk for heart disease, increased risk for blood pressure. There could be increased risk for stomach ulcer also. So usually I would say like around 10 to 14 days is safe in my opinion. However, when patients already have pre-existing conditions such as kidney disease or heart disease, then this medication may not be safer. So let us say the patient has to take NSAIDs every day. So they have to take ibuprofen or naproxen every day. Or let us say the patient cannot take these medications. Then I offer them a cortisone injection. So think about like a cortisone injection, also called a steroid injection. So it's almost like putting a bottle of ibuprofen into the knee. So it starts to provide a local anti-inflammatory effects in the knee, and sometimes they can help for around 3 to 6 months or sometimes even up to 1 year or so. So now let us assume that you got the pain under control. So every patient of mine will get a physical therapy prescription to focus on stretching the muscles around the knee as well as strengthening the muscles around the knee. So we're going to focus on quadriceps strengthening, we're going to focus on hip strengthening as well as core strengthening. But let us say the patient cannot go to physical therapy because of time constraints or money constraints, then I give them a home exercise program. I want to really stress here that physical therapy is an important component of the treatment plan for knee osteoarthritis. Now this becomes a very sensitive topic for my patients, but usually I ask permission before I talk about it because this is really important in getting your knee pain under control. If the patient is on the heavier side, so anybody BMI of more than 25, then we talk about weight loss. So even a 10% weight loss can actually provide a significant benefit to help your knee pain. So then we talk about nutrition, which is really key in helping to alleviate inflammation. So there are certain foods that can help reduce inflammation. So Dr. Andrew Weil has an anti-inflammatory diet pyramid to guide people in their eating habits. So basically it suggests limiting simple sugars and consuming 5 cups of vegetables and 2 cups of fruits per day. So healthy grains like quinoa, bulgur wheat, brown rice, barley, and ragi should be included in the diet, as well as spices such as turmeric, pepper, and paprika for flavoring. Asian mushrooms such as shiitake mushrooms are also beneficial to eat. Red meat should be consumed once a month, or if you can avoid altogether, that's great. So those who can enjoy fish can opt for sardines, mackerel, or wild salmon, which are high in omega-3 fatty acids. Vegetarians can consider incorporating flax seeds and chia seeds in the diet to increase their omega-3 fatty acid uptake. Olive oil is recommended for cooking. I would recommend avoid fried foods at all costs. Incorporate a lot of raw nuts in your diet. So then we talk about exercise, because fitness is really important for long-term wellness. In order to improve fitness, exercise is key. So low impact exercises such as biking, swimming, walking, and elliptical training are very ideal. This type of movement helps to keep your body healthy while reducing the risk of worsening pain from knee arthritis. If running is something that you enjoy with no worsening symptoms, by all means give it a go. However, if you're an avid runner or prefer high impact exercises like basketball, you may want to consider cutting back on the frequency of these activities. Maybe try sticking to 1 to 2 sessions per week, and then focus on more low impact movements throughout the rest of the week to keep your knee happy. So now for patients with nagging knee pain, I talk about an intervention called as a Viscosupplementation injection. So think about putting a lubricating gel inside the knee, thereby it coats the bone and thereby decreasing friction and thereby decreasing inflammation. Unfortunately, studies show that it does not work for everybody. In my opinion, it works more for this nagging knee pain in patients with mild to moderate knee osteoarthritis. I've covered in detail about Viscosupplementation injections, and I've included the link in the description box below. Now let us talk about supplements. So turmeric supplement, basically the active ingredient curcumin, actually has evidence behind helping pain with knee arthritis. Other supplements such as chondroitin, glucosamine, ginger, they do have evidence, but they're very conflicting in nature. So basically what that means is that it doesn't help every patient who take it. So what I usually recommend to my patients is that try the supplement for maybe like 2 to 3 months or so. If you start to notice benefit, then just continue taking it. If you don't notice benefit, then you can stop spending money on those things. So I also talk to my patients about mindfulness exercises like meditation, breathing techniques like pranayama to keep the stress levels low, thereby decreasing chronic inflammation. Now let us talk briefly about regenerative medicine treatment options like PRP and stem cell treatment. So these are all newer treatment options, and there is some controversy whether these interventions really work or not. Unfortunately, the insurance do not cover these procedures, and they can run anywhere between like $700 all the way to $2,000 or so forth. There is some good evidence behind platelet-rich plasma, which is based on the PRP, to help with knee arthritis, and I've covered 2 videos on this particular topic, and I'm going to attach the link in the description box below. However, stem cell treatment, there's a lot of conflicting evidence and I usually don't recommend to my patients. So finally, we talk about knee braces. So knee braces can actually help with knee arthritis pain by improving the muscle activation, basically improving the joint proprioception. And I've made an entire video on this topic, how to shop for knee braces, and I'm going to attach the link here. Okay, so most of my patients do really well with all these treatment options, but let us say if they continue to have persistent pain or mobility issues, then it's time to consider a knee replacement surgery. Okay, I hope this video is helpful. If you have any questions or concerns, please post in the comment box below. If you really enjoyed this video, if it was really helpful, please make sure that you hit the like button. And then if you feel like it could be helpful for other people, please make sure that you share this video. And I'll see you in my next video. Until then, goodbye.